So, what's actually going on with Sonder Health Plans? Sonder Health Plans is a Medicare Advantage company that offered Medicare Advantage plans in the state of Georgia. They only were servicing the state of Georgia. Fairly new company. I believe they've been around for about 5 or 6 years. But the unfortunate part about it is that Sonder Health Plans was placed into receivership by the state of Georgia because they were deemed financially irresponsible. Now, you may be sitting there saying, like, what's that actually mean? Well, when you're a big insurance company and you are responsible for people's insurance needs, such as going to the doctors, picking up their medications, and all the other things that come along with being an insurance company, you have to have a certain balance sheet. And on your balance sheet, you have to have income and funds that are appropriate for being an insurance company. The problem is that Sonder Health Plans was not in a position to continue doing what they were doing. So with that said, I want to get into it and talk to you about what's going on with Sonder Health Plans and what you need to do in terms of getting yourself out of a bad situation to make sure that you're in the best situation possible going into the annual enrollment period. With that said, my name is Kevin Stevens, formerly known as the Medicare Mogul, here to give you all the information you need in regards to not just Sonder, but Medicare in general. So with that said, sit back, relax, and prepare to be educated. Now, Sonder Health Plans was a local company in Georgia that was very small in size, but mighty, I would say. Sonder Health Plans offered a tremendous amount of ancillary benefits to the consumers that were working with them. I think there was about 25,000 seniors on Sonder Health Plans that were getting benefits such as food cards upwards of $400, getting over-the-counter allowances up to $200 every quarter, and they also had very low maximum out-of-pockets, meaning that when you went to your doctor or you had a surgery, the co-pays were extremely low. Sonder Health Plans had very good plans, in my opinion, in terms of the benefits they offered and in terms of the cost control that they offered. And they were really good at communicating with a specific demographic. So, for example, if you know anything about Sonder Health Plans, the target market of these individuals was to focus on people who had chronic health conditions. These chronic health conditions focused on something like heart attack, any type of cardiovascular issues like strokes, cancer, also diabetic plans. They had COPD plans for people who had asthma, renal disease. They had like kidney plans. The plans that they offered were very unique, and they were really meeting people where they were at in terms of what I would say, right? Like there were no plans specific to Georgia that were really offering what Sonder Health Plans was offering. So for the individuals that were on Sonder, they became used to these plans. They became used to these benefits, and they were very happy with these benefits. And to be honest, personally, I was very happy for the clients because I've never seen anything like this. So my organization as a whole, we had about 1,000 or so members with Sonder Health Plans. Not just me, but colleagues of myself and other individuals in my organization. The unfortunate part about it, and this is just my 2 cents, is that all these individuals that became accustomed to using Sonder Health Plans benefits, they have to be changed over to a different company because, as I said earlier in the video, Sonder Health Plans is in receivership. Now, if you are someone who is in Sonder Health Plans and did not hear about this news, I'm sorry that this is coming to you in this way, but you need to make a change. You need to contact your broker or your agent, or you need to contact our office. And that is not a shameless plug. We just want to make sure that you get a plan that's going to be appropriate for you so that you can continue along with your health care. Because we know that Sonder Health Plans is currently in a situation where they have been received by the state. So as of October 1st, those benefits that you have from Sonder will no longer be in place. And then in addition to that, if you don't make a change before October 1st, the unfortunate part about it is those individuals that stay on Sonder Health Plans, they will be returned back to original Medicare. This is a big problem. You do not want to be returned back to original Medicare, because if you are, what's going to happen is that Medicare covers 80%, then you become responsible for the additional 20%. So if we do the math, and let's say you get a bill, you go to the hospital, God forbid, you get a bill for $100,000. Instead of that bill being something like $200 on a Medicare Advantage plan, because your co-pays are already structured and communicated for you, on original Medicare, you're responsible for 20%. So the problem is that if you're responsible for 20% and you get a $100,000 bill, you are then responsible for $20,000. So make sure you call our office. The number's right here below. Call our office, email us, or you can also text us. Make sure that you get that plan changed ASAP to a plan that is in your area, that is actually working with your doctor, working with your specialist, and going to get you the medications and going to get you your dental or your vision coverage. Now, the last thing I would add on this situation is that is an unfortunate, yes, but what we can do is we can focus on what's in front of us. We can't go back and say, hey, I wish Sonder would have did this or did that better. The unfortunate part about it is that it's happened. We can only move forward, and we know that we have the information to make a better decision today. So with that said, I hope you all have a great day. Wish you the best, and talk to you soon.